with you on this issue if we are able to get past, this committee, and I would give you my word to engage with you and meet with you immediately thereafter. If we get past this committee.
I appreciate that. Is that to be interpreted that you would be willing to get the information from a study that would look at all this? And I would support. And if it turned out that that were the way to go, I'd support it in a heartbeat, because I do believe the safety of those workers is that important.
I think that we have to, be very, very careful how we proceed with this. The good doctor who came all the way from the state of Texas to give her testimony. The one thing I don't want to do is I want to be very careful is we don't start having a methodology debate. Quantitative as qualitative, and going through, which study comes from which place, which PhDs, which universities, and we just go back and forth with qualitative as well as quantitative data analysis right now. I think that when we talk about good science, I think we can put good science to the side just for a quick second and just look at common sense. I think that above and beyond anecdotal evidence you could actually almost package this as qualitative research with regards to the number of men and women, vast majority, if not almost all women who are present here today, over 75 women who've come throughout the state of California, losing a day's pay to come up here to testify that we have plenty enough data, evidence, and empirical data that clearly states that we have workplace injuries that correlate with the usage of flat sheets and without the access or mandated, if you will, of a longer, instrument, tool in lieu of what we call el cortito. When El Cortito, that was articulated earlier by Mr. Ruda Flores in the Central Valley, the most sophisticated agribusiness, not just in the nation, but in the world. Back then, they didn't have studies or reports with regards to agronomics. In fact, I would venture to say that the concept and the idea of agronomics was non-existent back in those days. And I don't know if there was a lot of methodology, scientific data and research that was put forth with regards to how folks advocated for safer and better worker rights and better working conditions, so you can reduce, in this case, as you underscored, with regards to financial incentives. Obviously, whether it's workman's comp, other types of injuries, we want to reduce that. That's our financial incentive right there, first and foremost. I think it's quite telling that you have a representative from the applicant attorneys who I would venture to say, and you correct me if I'm wrong, they make money, obviously, profit from representing men and women who are injured in the workplace. They're coming here with a preemptive strike, if you will. Obviously, I don't know if that behooves them in their own financial gain to move forward, and how do we reduce workplace injuries by by instituting preventative measures to protect workers and improve the quality of their conditions in their workplace. So with that, I want to move forward with this measure again to underscore and get back to, with respect to our chair and the members of this committee. If we get out of this committee, I'd be more than happy to engage with you more. So with regards to El Cortito, the short-handed map, it's been a long time. It's in the regulatory process right now as we speak with OSHA. And we still haven't had any conclusive decision coming back yet. And I can't wait any longer, because we have men and women, again, the vast majority of women who work day in, day out, who are being injured in the workplace right now. So I'll just, answer your question.
Just like to, again, I appreciate the author's comments. I'd just like to make clear what I was talking about. We all know that whether it was El Cortito or the Brazo del Diablo, that was hard work, and I'm glad that they've made it safer. I don't think it's relevant to what we're doing today, although it's very powerful. And I don't care what the labor is. I just want to make it clear that I believe the number one thing we need to do is make labor safe, reduce injuries. I did that when I was in business. I believe it's the right thing to do, and it comes before costs. All I'm suggesting is that a scientific study, and perhaps the point of view of the professor from UCSF would be the one that would prevail. I don't know. But it just seems to me, rather than the impression, and we certainly know it's very emotional, we could either validate that or not. So that's what I'm talking about. It's just the scientific answer to that. I would make a motion, but I think I wonder what the outcome would be. Is there a discussion of a motion?
Why don't we hear from the members first? The rest of the
You mean I might learn the fate of such a motion by listening? I would be incredulous if such a motion were to make it. Yeah, I think I appreciate that.
Thank you, Senator Runner.
Well, I'm sorry, I was in another committee hearing. I missed the testimony here. I'm sure it's very emotional for those of you who are here, and I appreciate you coming and spending the day and doing that. I'm a little confused with the contradiction in the studies. It's the only thing clear to me is whether the mandate in this bill is a good idea is questionable. The regulatory environment is a forum, as Mr. Belote talked about, to bring clarity to these issues. And why would you not consider these issues being in that forum? And I know you answered a little bit with Senator Weiland's question that as far as the use of the long handle, it's still being talked about in those forums rather than a decision being made. And what I see also in this bill is there is a mandate for the use of long-handled tools. And the gentleman from San Francisco actually said that some people still prefer the short handles. So is it a mandate you would have to have long-handled, even though some people would prefer the short handles? And as I read it, it looks like it is. So if you can answer a couple of those questions, it'd be great.
My understanding that there is no handle right now, so there's no handle, there's no mandate with regards to the tools itself. I did, partially answer that question, but let me say this too, Senator Runner. The study that folks made reference to, that you made reference to, and there was a study that was disseminated. I have yet to even, look at that study because I wasn't, for whatever reason, given the courtesy of looking at the study because I haven't even received it. This is the first time I've seen it disseminated among my colleagues here on this committee. I wish I would have been able to read it to understand the methodology, that's the conclusions and any recommendations, or if it was in fact refuting any the study that the MD doctor from the University of San Francisco represented today. But I have yet to look at that study again, going back to the battle of studies and empirical data and evidence, what have you, et cetera. I was not given that study at all whatsoever.
Thank you. I appreciate that. And
thank you, Senator Runner.
Again, I would rather have it in a different forum than being here on the bill. Thank you.
All right. So we have Senator Padilla has a question.
Thank you, Mr. Chairman. Let me, sort of preface a couple of comments and questions with a recognition that this bill pulls at my heartstrings. Kevin, as you know, my mother didn't clean hotel rooms. She cleaned houses. So, well, not quite the same work, not completely different work. And just recalling days as a child when, for whatever reason, I wasn't going to school that day, faking an illness or whatever it was, saying, okay, not well enough to go to school, then you come with me to work. And knowing what it's like to, scrub toilets and mop bathrooms and change sheets and doing all that stuff that happens throughout a house. Flash forward to today, and can you draw that direct correlation between my mother's arthritis to day after day after day of the work that she did? Maybe not. Maybe I should send her to Texas or UC Davis or wherever one of these studies is taking place. So anything and everything we can do to provide improved working conditions for the men and women who do this tough work is, I think, part of our responsibility and obligation. So I will be supportive of the bill. That being said, I guess in a slightly different way, I'd ask the same question that some of our colleagues in the committee have asked, which is, the bill starts out reading perfectly. You recognize there's issues, recognize there's problems. There's OSHA and an OSHA process to begin to address them, and so you want to send that charge. The bill goes on to sort of give specifics. Well, while you figure out what the regulations ought to be, make sure it includes X, Y, and Z. So just kind of how you arrived at wanting to put that into statute. This is more of a process question, not a policy question, but a process question. How you arrived at sort of putting that into the directive up front before OSHA would conduct a process similar to kind of what's happening here. I think Mr. Below put it fairly well. This is becoming a mini regulatory hearing from both sides, trying to hear from scientific experts and others, and trying to legislate that. I'm not so much concerned about the slippery slope argument that this committee is going to find itself hearing in this forum any and all regulations, past and future, for OSHA. But if there's a process that is set up to perform a certain function in state government, why we're not letting that process run its course.
And Mr. Padilla, Senator Padilla, I appreciate your comments very much, and I know that with regards to your mother, although she didn't work in a hotel but was a housekeeper, such as my mother too, worked in hotels as well as in private homes, cleaning homes. I appreciate your comments very much so, and also with regards to process, also to no doubt, like I said to Senator Weiland, I'd be more than happy to engage you if you're so. If you'd like, I should say, on this process right here too, as we move forward with this measure.
So, and then the other piece, I know I chatted briefly with Senator Weiland about, I think one of the unfortunate things about this setting, we have the proponents that have their studies, and obviously they may or may not be biased because they're representative of a certain perspective, and you have both proponents and opponents will have their experts that they can point to, reports they can point to, et cetera. It may be helpful either for OSHA, for the legislature, a combination of entities within state government to try to find our own neutral parties to, either affirm or contradict the findings of others. California's a big state. Tourism's a big industry and engine for our economy. Somewhere, maybe in the UC system, for example, there's got to be some sort of hospitality program that has at least considered or begun to discuss these issues. Maybe there's some state resources and knowledge that we can tap in making sort of the determinations through independent thought. I think that can be helpful. So I think Senator Weiland offered, if not a hard and fast amendment, at least sort of a question, and I'll rephrase it. It doesn't have to necessarily be a formal amendment to the bill. There's informal ways of tapping into that knowledge, whether it's a letter, whether it's a meeting. Maybe it is a bill that suggests to OSHA, while you do this regulation, reach out to the UC system and, X, Y, Z. So I think they're coming at it from a vantage point of trying to improve upon the bill.
And I did take it as a wonderful suggestion, as opposed to, like I said, an amendment on the fly in committee.
Not to belabor the point, but similarly to Senator Weiland and Senator Padilla, as somebody who wasn't a housekeeper but was a member of the hotel union, it doesn't preclude the Standards Board from looking at these two specific things. And I'm correct. Sure if we felt, or if they felt, and we collectively felt that there was an impartial third party, which they're supposed to be, and the administration felt that these rules actually were a detriment to worker safety, we would reconsider that. And maybe you can respond to that, Kevin, or...
It doesn't preclude, my understanding doesn't preclude, and we'd be completely open to it. Yeah.
So the Standard Board would look at all of these things.
You can look at it, absolutely.
So to Senator Weiland's comments and Senator Padilla's, I think it's sort of inherent in the bill. We can still have the discussions, and I think they're good discussions.
There's nothing that's prohibited in the measure itself.
Thank you.
Senator Leno. Thank you, Mr. Chair. And thank you for all the time you've allotted the bill to be heard, because there's clearly a lot of interest in it. As I had mentioned earlier, I thought some of the testimony be incredulous. The idea behind the bill, I think, though, is, as you've mentioned, Mr. De Leon, common sense. I don't think we really need to study to determine the benefits of fitted sheets. The market has driven fitted sheets, and the doctor from Texas has only fitted sheets in her home because they are by design and intent less time consuming to use and less taxing physically. That's why they exist. So to debate whether or not this is going to slow productivity or that some housekeepers actually hate these sheets is really a difficult argument to digest. I was also curious to hear that from one presenter that there's been, as a result of green housekeeping, which I certainly applaud, a 50% reduction in sheet changing. And I know that, as probably all of us when we stay in a hotel,
we see
put the little card on the pillow. No, you do not need to change my sheet every day. That'll be just fine. But then I also heard someone say that sheets are cleaned every day. So I don't think that was accurate. But also said that they're replaced every 50 days, which leads me to one suggestion I might make to you as the bill moves forward. I spoke with some of my friends at the San Francisco Hotel Council. They already have the provision of ergonomic tools, long-handled tools, so that's not an issue for the San Francisco Hotel Council. But they did have concern that a mandate would require them to immediately toss a whole inventory of non-fitted sheets. So I don't know if sheets are replaced every 50 days or if they're replaced every 90 days. If there's a way to determine if they have a life year to them, that we might want to consider, so there's not an onerous burden on hotels to have to go out and purchase a whole new inventory of sheets, that as they are replaced, that they would become
I would be totally
fitted
open
sheets.
to that.
So that's one concern. And then we heard that we're going to have housekeepers forced to use tools in cleaning closets and poking each other's eyes when they're using them in the room. I'm just looking at the bill. It says the use of long-handled tools such as mops or similar devices in order to eliminate the practice by housekeepers of working in a stooped, kneeling, or squatting position in order to clean bathroom floors, walls, tubs, toilets, and other bathroom surfaces. This is specifically for bathrooms. But again, if there is a particular task in a bathroom that doesn't require a long-handled tool, that you might even include the use as requested by workers of long-handled tools, so that a worker would have the option. So the tool would fit the task, as simple as that. But aside from that, I think the testimony was very compelling, and I don't think that this will be detrimental. I think that this will, in fact, increase productivity, that we may see workers able to clean more rooms in a shifts period, because that's why fitted sheets were invented. So I applaud you for your efforts here, and I think that there may need some tweaking to the bill, but otherwise I am happy to support it and make the motion for the bill.
Thank you, Senator Locke. Thank you.
Senator Yee.
Thank you very much, Mr. Chair. And let me just sort of add my voice to this particular bill. This is a extremely important bill. I think the proof of the pudding is the fact that you had three housekeepers come before us and literally, begging for some kind of action on our part to deal with their long-suffering pain. Somehow, some way, the regulations have not taken care of their needs, and so if this bill will at least move that issue forward, I think this is a good thing. I think the difficulty is that we have heard some conflicting information, and as this bill moves forward, I'm sure that you're going to be staying on top of it and to try and deal with some of the difference of opinion. I mean, it is rather interesting that you have some individuals from the industry saying that some of the workers prefer certain kinds of instruments, and I think that also needs to be looked at. Sometimes it may be a little jaded because some individuals may be put in a position where they would prefer one instrument or the other. So I think that we need to, nevertheless, still look into that particular claim. I don't know if there's any data on that. I think it's important to look at that. I think ultimately, we don't want to establish any rules and regulations based on vagueness of data. We need to be very, very clear on that data. But the reality is that whatever the data may be, you have individual workers right now who are suffering, who are in pain, and we ought to do whatever we can to start the process of trying to address that. And I think this bill does that, and I will be supportive of it.
Senator Padilla?
Just want to add one last comment. Again, supportive of the bill, but just something to consider as the bill moves forward and as the regulatory process, hopefully called for by the bill, advances, that there should be somehow a workforce awareness or education component to this, a compliance component to this as well. And I say that because, not just because of the experience with my mother, but my father and what he did and others, a lot of times there's pride in your work that sometimes leads a worker to kind of deviate from the standards that we're setting. So, with all the best intentions, we're going to suggest not just a type of sheets, but what tools ought to be used, and this and that. I've just seen it too often from even constituents, not just family members. Well, I know I'm supposed to do it this way, but because this is cleaner, because this is more effective, because whatever, there's sometimes deviation from the rules that we'll suggest. Sometimes maybe it's a little bit healthier. Sometimes it can be a little bit more dangerous, short-term or long-term. So just a recognition that we can set all the rules and laws that we want, but in actual practice, there's a significant, I think, training, education, compliance component that needs to go along with it.
So, here are my thoughts on the bill. There's, time and again, we are called upon this legislature to look at issues that sometimes have studies attached to them or different experts testifying. I just note that there was agreement today on the experts on one issue. Even their opposition expert witness conceded that having long-handled tools available at hotels was a good thing. And I think there is just no dispute on that at all. And so on that part of the bill, I fully support. And sometimes I like to say, government works at a majestic pace. And maybe OSHA has been working at this majestic pace for quite a while. This sort of gives them a kickstart and says, you got to do this. On the fitted sheets issue, I can only rely on common sense, the fact that probably most of us use fitted sheets. I am sensitive to what Senator Weiland and Senator Padilla said. The reason you might want to alter that going forward is you might actually get a broader bill, because maybe what OSHA will say is, hey, let's have back wedges at every single hotel, right? Or maybe there are other things they could do that might even have a better impact on workers. So that's just something to consider going forward. I will support your bill today as is. But you may want to look at the second component. I just note for the first component, there is no dispute. What I heard today, everyone pretty much agreed. There is no downside from requiring long-term tools to be available at hotels if workers choose to use them. With that, I'm going to call the roll. Senator Leno made the motion.
Mr. Chair, let me just add a couple things. One, Chairman Liu, I want to thank you very much for your patience today. This was a very long testimony on both sides on a very emotional issue. I think I have an occupational work injury for sitting in this chair for 2 hours now. There's a doctor in the house. This is in my tenure, and a lawyer too. I got a lawyer here too. In my tenure in the legislature, which has not been long, since 2006, this is the longest measure I have introduced, time-wise, in the committee. I wish it was optional. So, Mr. Chair, I thank you very much for your patience, and I thank my colleagues, senators, for your patience too. This is a very important issue on both sides. There's a lot of emotion. For the hotel industry in the state of California, which is an economic engine, especially during the current economic climate, we want nothing but the best. We want every hotel room, regardless if it's a luxury high-end hotel room a mid-level or even a lower-end hotel room, we want it to be full to capacity because that means more tax dollars are being spent and left here in the state of California. At the same time, we want to make sure, and I know my colleagues, Ms. Runner and Mr. Weiland, also believe in this strongly, that we want to provide as much as protections as possible for the workers, so the workers are not as injured. But I would say this. Many of us have stayed in these very nice hotels, and we have stayed in what they call the Sweet Dreams mattresses, heavenly beds, and I will say this. Those beds are over 200 pounds, and there's nothing sweet or heavenly about having to lift these 200-pound beds to put a flat sheet right underneath. I would say it's neither sweet nor heavenly, but it's rather a nightmare for these women, because what we're talking about is broken backs, we're talking about sciatica, rotator cuffs, we're talking about plantar fasciitis. This sounds almost like the NFL or the NBA, but it's not. It's the hotel industry and the hotel workers here in the state of California. And oftentimes, like my mother, we have individuals, women, many of them in this room, who are the only caretakers in the whole house, single mothers. When their back is broken, they can no longer go back to work. And they're the ones who are paying the rent, putting the food on the table, putting the clothes on their children's back. When that income dries up, then there's no other income left to take care of the kids. That's why this is a very, very important issue to these women. What I would say is that oftentimes, unfortunately, but this is the reality, these women are often invisible in the hotel rooms. Regardless if you're a Hollywood rock star or politician or a tourist coming in from Florida or New York or elsewhere, when you see these women in our hotel rooms, they're often invisible. They don't exist to the patrons. And I want to make sure that we give them the dignity and respect that they deserve. Again, I thank you, Mr. Chair, for your patience today. I've received, wonderful, good input, and I hope that I can receive bipartisan support for this measure. Thank you, Chairman.
Senator Weiland?
I appreciate that, and I just want to explain why I can't support it today, and it's because it's the way it's written. But I do think worker safety is utterly paramount, and I'm going to watch it as it proceeds. And to me, that makes a lot more difference than the financial part. I think that is paramount. I appreciate the intent behind it.
Senator Leno has made the motion. Take the roll call.
The motion is due pass through Probst. Liu?
Aye.
Aye. Weiland? No. Weiland, no. DeSaulnier?
Aye.
DeSaulnier, aye. Leno?
Aye.
Leno, aye. Padilla?
Aye.
Padilla, aye. Runner?
No.
Runner, no. Yee? Aye. That measure has 5.
No one, everyone's
Aye,
here,
5,
right?
yep.
All right. Your measure's out. Thank you. Senator Leno has requested to present next. He's got some witness issues, so go ahead.
Thank you.
Okay, all right. I'm going to take a real. I'll be back in 2 seconds. Okay. I think things sort of, there was a bit of a break we all had to take after the last bill. I've been asked by the patient folks in this room to hurry things along, but we have a member of the committee, an author of bill, Senator Leno, and I think you should take the time that you believe is correct to present your bill.
Thank you, Mr. Chair and committee members. I think we can all agree that for the sake of a competitive marketplace, that all employers should play by the same rules and that all employees should receive adequate workers' compensation benefits. To that end, California has a workers' compensation information system, and this is an electronic database which evaluates the efficiency and the effectiveness of the benefit delivery system and also monitors the timely delivery of benefits to injured workers. Unfortunately, though we have existing reporting requirements of employers, they are not all reporting. They're not all reporting at all, and some are reporting but not comprehensively and fully. Unfortunately, the Division of Workers' Compensation, which oversees this system, does not currently have the ability to enforce compliance with the existing Workers' Compensation Information System reporting requirements. And so all this bill does is gives the Division of Workers' Compensation that ability to enforce the compliance with these existing requirements. The Commission on Health and Safety and Workers' Compensation issued a memo which indicated that 10 to 25% of required reports to the system are incomplete or not filed at all. And this bill will, as I mentioned, give the authority to the division to assess a penalty of no more than $100 per violation and no more than $5,000 in a calendar year. Now compare this to the state of Texas, which has an approximate 95% compliance rate and has a maximum penalty of $25,000 per violation. So I want to recognize that the bill penalizes failure to report data, whether it's a failure to submit a report or to provide complete data. One is more serious than the other, but both failures mean that the data is not reaching the division. So we'll hear from the opposition that we need to better clarify that, and we'll have a stakeholders group moving forward. So I suspect that there will be some amendments to the bill so that we can differentiate what the different kind of violations are, and so that we can give the authority to the division to better fine those according to what they have done. This bill was brought to my office by small businesses of California who are concerned that there's not a level playing field right now. And so that would be the Small Business California, and the president of Small Business California, Scott Hauge, is here to share some of his thoughts and concerns and why he's brought it to our office.
Thank you. Good afternoon, members. My name is Scott Hauge. I'm the president and founder of Small Business California. I'm also a small business owner. Small Business California has a network of 5,000 small businesses. We also have affiliate members, the Plumbing, Heating, and Cooling Contractors of California, CalTel, and the Northern California Retail Booksellers Association. As we see it, this is a pretty simple bill. It's not changing a law or changing anything except to provide a vehicle to implement the existing law. The reporting requirements are there right now. There's no change. But the difficulty is not all claims administrators are reporting the information. And as Commission on Health, Safety, and Workers' Comp has said, they feel that 10 to 25% is not being developed. And as a result, how do you make policy when you don't have all the information? And that's important to small business because we're impacted by workers' compensation, and we want policies that are accurate. And you can only have accurate policies with proper reporting and on a timely basis. It's not the intent of this to be heavily punitive and go after small violations or innocent errors. It's really going after where there's significant errors, non-reporting. And as I said, I think this is a very simple bill, and we ask your support on this bill.
I'm Lachlan Taylor on the staff of the Commission on Health and Safety and Workers' Compensation. This commission was created by the legislature to analyze the workers' compensation system and make recommendations, and the commissioners are representatives of labor and employers represented by the governor and by the legislature. So our meat and potatoes is research and data, and we would love to be able to answer questions like a certain type of injury rate in a certain occupation, just as the last bill you heard. But if the data is not there, we're not able to come in and give you that sort of research. We do get some data from the insurance community, which represents 70% of claims, but we don't really know much about what's going on the self-insured side. So we tend to extrapolate from what the Workers' Compensation Insurance Rating Bureau can tell us, but that's probably not exactly accurate. In fact, recently we had workers' comp reforms that allowed companies to set up medical provider networks. Self-insured employers are telling stories about how great it's working, while the insurance industry is looking at possibly a 40% rise in prices. We need the data to understand what's going on in different market segments in order to be able to answer the questions that you need answered to make policy decisions. One of the most frequent errors is we don't even know what the occupation of the worker is on the data reports. We don't know who the third-party adjuster is in some cases. And we appreciate the senator and I appreciate the sponsor for bringing this to your attention so that we can get better data to do better research to help you make policy decisions for the state. Thank you.
Mr. Chair, members, my name is Phil Vermeulen. I represent a major third-party administrator by the name of Acclamation Insurance Management Services. They're located throughout the state. We initially had concerns about the bill. Obviously, it talked about claims administrators, but I have to take my hat off to the author and the sponsors. We've been working hand in hand, and we're very close on language that I think is going to be fair and equitable for everybody. And for those reasons, my client has said definitely come in and give us a thumbs up today on the bill. So we would urge your aye vote. It's a very important bill. Thank you.
You can come back. Huh? You can come back. Come back after these other votes. Yeah.
Mr. Chair, members, Caitlin Vega for the California Labor Federation. We're here in support. We think that access to this accurate information helps the legislature to make the best decisions for workers and for employers. And so we think that this is an important bill to ensure that good employers are rewarded for doing the right thing. Thank you.
Thanks. Mr. Chair, Mike Carroll with the California Applicant Attorneys Association. Good data makes good policy. We need to have all of that data collected for both our administrative, regulatory work, and for the work that we do here in this building. We urge an aye vote.
Good afternoon, Cynthia Lamb with the California Manufacturers. We did propose an opposition on the bill because we believed it was too broad. I'm also here with the California Coalition on Workers' Compensation and the California Association on Joint Power Authorities. All of us have agreed that we want to work with the Senator on clarifying the bill because we do believe information does provide a better work comp system as a whole. So we're looking forward to working with the Senator and the stakeholder meeting that he's holding this afternoon. Thank you.
Thank you.
Any testimony in opposition?
That was.
Don't you wish all opposition was like that? I wish opposition to my bills was like that. Questions of members. Senator Runner.
Thank you. I support the idea of the bill. I'm a little concerned about the fine. And we can't do it without fines. And I understand Texas has huge fines. No way to do it without the fine factor.
Everything's big in Texas.
Yes, that's right. We can't do it without the fine structure, you don't think?
Sure. This is why we're having the stakeholder process. Currently, as the bill is written, it's up to $100 for violation. So if it were just some small bit of information that was left off the reporting, clearly the intent would not be for the $100 fine, but for something less than, but something to give some incentive for people to obey what is currently required of them, and then no more than a $5,000 for the entire year. Again, in Texas, $25,000 up to per violation, and clearly not all violations are created equal. So that's what we're going to be addressing through the stakeholder process.
We're right at questions or comments from members.
We're asking for an aye vote.
You just closed.
Any other questions from members?
I've got one.
All right, Senator Weiland.
I really support that we need this data, and having been an employer, you need the data. You need to know. And I'm not concerned about the penalty, particularly. I think you need to have a way to make sure this happens. I just have a couple of questions. Is this, say I was an employer. My insurance company does all the claims administration. If they fail to report, who's going to be on the hook for that?
The party who's required to report under the regulations is the claims administrator. That's the one who would be accountable.
Okay. That answers that question. The only other question I've got is, and maybe I'm misinterpreting this, I'm being told that already under a code section that the administrative director may assess an administrative penalty if there's failure to comply with a notice of assessment, failure to comply with any rule or regulation of the administrative director. Is that something you don't currently feel you have sufficiently?
The general authority that you just described is enforced through an audit process. This is a labor-intensive process of auditors going out on a 5-year cycle and looking for the most important issues, such as paying benefits to injured workers and notifying them of their rights. It's a very cumbersome process to use that for what is meant to be a small and just a nudge.
Okay. So this doesn't. The idea behind this is you don't have to go through the audit. You just go ahead and do it. Okay. I like everything about this idea. I'm just going to hold off until after that stakeholder meeting. But frankly, I don't see anything wrong with this. And assuming that works out fine, and depending on what their arguments are, it's hard for me to see an argument against it. I'm going to be supportive at the next.
That's high praise, Senator. I thank you.
Well, when you get a good bill, when you get a good bill, see.
Thank you.
A few more of those, and we can have lots of high praises.
Any other questions? Do we have
I will vote for it the next time.
Next time, maybe.
I might vote for it right now.
You want to make a motion, Senator Weiland?
Sure. I move the bill.
Roll call.
Lou?
Aye.
Lou, aye. Weiland?
Aye.
Weiland, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Leno?
Aye.
Leno, aye. Padilla? Runner? And Yee.
That was high praise and high action. We'll leave the bill on call. Senator DeSaulnier?
Learn from Senator Leno and Senator Weiland.
Not based on shame, please.
I know.
Judicious understanding of the issue.
I have been practiced in the art of Catholic guilt, so I'll try that. How's that? Mr. Chairman and Senators, first, let me thank the Chairman and many of the members and a lot of the stakeholders for being accessible and working on various concerns that I will try to address in our presentation. First, let me say that 575 is an ongoing process of following in the leadership of California. In 1994, the legislature adopted the California Smoke-Free Workplace Act that led to, on January 1st of 1998, California becoming the first smoke-free workplace state in the country. This legislation would bring us back to that, well, actually, not up to leadership standard, perhaps, but at least the national average. 25 other states in the District of Columbia has surpassed us, according to the Center for Disease Control, in providing worker safety when it comes to secondhand smoke. We know that secondhand smoke is the third largest cause of preventable death in the United States, and this legislation is meant to close some of the loopholes that were in the law when it was originally passed. We've been working with stakeholders, and I know that they will testify, and I know that the chairman, as I am sympathetic to some of the businesses who would be at risk if this law were to pass. So I promise to continue to work with the chair and with those affected stakeholders to try to find a workable solution. This bill would close the loopholes, basically, specifically would not allow for smoking in areas of a lobby in a hotel or motel, meeting in banquet rooms in hotels and motels, also ban retail or wholesale tobacco shops, which I'll talk about a little bit longer, warehouses, break rooms, employers with a total of 5 or more employees, owner-operated businesses, and smoking rooms in nursing homes. It also require a change in the number of hotel rooms, going from 35% is required to be non-smoking to 80% non-smoking, not to get into a discussion about hotels again, but I think all of us would realize that the market has largely gone to much higher than 35% non-smoking anyways, because that's reflective of what Californians want when they go into a hotel. In regards to tobacco shops, I have been presented by constituents, and I know many of you have as well. I've gone to visit one shop and plan on going to more, including this weekend in San Francisco. I've got some communication from the Occidental Grill, I believe, in San Francisco, right across from the Bank of America building in San Francisco. So I know that Senator Yee showed me a whole list of businesses in San Francisco. So basically, I want to commit that we will continue to work with them, try to come to a solution, but also we want to be honest about this. We're trying to not have anybody who's using that loophole as somebody who used to own hotels, not hotels, but restaurants, that people who basically have gotten around the prescription or the restriction on restaurants who make most of their income from selling food and liquor at a disadvantage for people who are selling tobacco but are using liquor and food as the largest part of their sales. So we want to work honestly with them. We also want to realize that Surgeon General has said there's no safe level of exposure to secondhand smoke. So when we're working with that constituent group, we want to figure out, and I think honestly, having talked with a few of their members, it is a concern of theirs as well. For instance, if they're in a building where certainly they have impacts on neighbors, we want to make sure that doesn't happen. So long story short, we think this is very important legislation. It's consistent with the proud tradition we have both in local government at the state level here in California of leadership on this issue. We understand it may impose some burdens, and we don't want to put people out of business who've been playing by the rules. The key part being playing by the rules. So we're willing to work with them to try to find an accommodation. And as I've said, I appreciate the chairman having a conversation with me, and we will continue to work with the chair as we go through those discussions. And with that, I will turn it over to my witnesses.
Go ahead.
Good afternoon, Mr. Chair. Good afternoon, Mr. Chair and members. My name is Dr. Diane Sipkovich. I'm a cardiologist and volunteer of the American Heart Association, and we're pleased to co-sponsor the bill. There's overwhelming scientific evidence that secondhand tobacco smoke is a direct cause of heart disease, the #1 killer of both men and women. Children of smokers have been found to have plaque buildup in their arteries at the age of 5. With smoking being a primary preventable risk factor for cardiovascular disease, the American Heart Association strongly advocates that all workplaces be smoke-free in California. Strong smoke-free place laws not only protect workers and the public from secondhand smoke, They also have been found to reduce the rate of heart attacks by an average of about 17% in a year and 26% after 3 years. The U.S. Surgeon General, as you've heard, has established that there's no safe level of secondhand smoke exposure. Ventilation cannot eliminate exposure of non-smokers to secondhand smoke. Establishing smoke-free work environments is the only proven way to prevent exposure. Yet, according to the California Tobacco Survey, nearly 14% of indoor workers are exposed to smoke at work. Rates of exposure are highest among young adults, Latinos, and low-income workers. Every Californian deserves to work in a healthy environment and should not have to choose between a good job or good health. We need to reduce the rate of heart attacks by 17% in these people. We can do that in just 1 year of a smoke-free environment. The American Heart Association respectfully urges your support for SB 575. Thank you.
Chairman Lou, Bruce Palmer with the Health Officers Association of California, representing the physician health officers in California's 58 county and city jurisdictions. I want to just take the time to very briefly explain to you one anecdotal situation that really points out the frustration that a local official with scientific knowledge, understanding the effects of a particular thing like secondhand smoke, where the imperfections in the current law make it very difficult to do anything for the people affected. In Santa Clara County, there's a mixed-use development where people chose between living in a smoke-filled apartment above a cigar lounge or moving out to protect their health. Now, understand that when they moved into this mixed-use development, it did not have the cigar shop. Subsequently, the owner told the residents and neighboring businesses that there was a ventilation system that would protect their units and the businesses from drifting smoke. That proved to be untrue. Residents and business owners did everything they could to stay in their homes and to maintain high-quality businesses that were also part of the shopping center and the apartment complex. They worked with the mixed-use development owners and managers, the San Jose PD, and code enforcements. They also attended tobacco-free coalition meetings. They collected petitions. They were extremely active. But in the end, they were not successful, and they were forced to move out of the mixed-use development in order to have a living standard that was smoke-free. Now, the point of this example is to clearly outline to you the imperfections in the current law and how in one clear situation that's been replicated in many other counties of the state have impacted the quality of life in a significant way of the citizens of a particular community. Thank you.
Good afternoon, Chairman and members of the committee. Paul Neprath, representing the American Lung Association of California, and we're also pleased to co-sponsor this measure along with the Heart Association and the American Cancer Society. The Lung Association was a strong supporter of the original legislation that's now nearly 20 years old. And this was, as Senator DeSaulnier said, the first comprehensive statewide law in the country. We think this bill is a great opportunity for us to extend and enhance that original legislation so that we can cover more workers on the job from being exposed to secondhand smoke. And it's really important to remember that the intent of this legislation originally was to protect people on the job so they don't have to choose between a job and their health. And that's why it was co-sponsored by the California Labor Federation and the California Restaurant Association and the California Medical Association some years ago. We're very concerned about the situation that Bruce just mentioned, and there are other stories, the toy shop in Napa, the clothing consignment store in Petaluma, and there are many other stories like that. But we're very concerned about how the loopholes in the existing law have been exploited to create sort of a new class of bars. There are two kinds, cigar bars and these hookah lounges or hookah bars, in which you have them basically operating, for all intents and purposes, like any other bar or restaurant bar combination that exists in California, but exists under the current law and the current restrictions for smoking. And so that's a very important aspect of this legislation, as well as the others, and to get us to be truly a smoke-free state here in California. The Lung Association is willing to continue our work on this bill. We think it's very important. We appreciate the Senator's lead on this, and we look forward to more discussions. We really urge your aye vote on this bill here today. Thank you.
Any other witnesses in support?
Alicia Sanchez with the American Cancer Society. As was mentioned, we're a co-sponsor of the bill and would ask for your support. Thank you.
Good afternoon. Steve Cruz on behalf of the County of San Mateo. We're in strong support, particularly its application to long-term care facilities. And just very quickly, there was a tragic death at a county-operated long-term care facility in San Mateo County last year. A patient who was smoking and cigarette dropped on his gown, and he died from those injuries. And so we're working with the author to make sure that it can adequately protect both the patients and the employees who are required to assist with smoking at those facilities.
Mr. Chair, members, Robert Harris on behalf of the California Society of Addiction Medicine. California's addiction medicine doctors headquartered in San Francisco. This is a very important issue for them. One, for just the health issues, and secondly, that nicotine is probably more addicting in some ways than any other drug. And so when you even begin to get people in contact with it accidentally, they begin to build the chemical relationship in their blood and in their brains that leads to addiction. So anytime you can prevent that, it's a good thing, and that's why the society wholeheartedly asks your support for this bill.
Ryan Spencer, California Medical Association, support of the bill for the reasons previously stated. Thanks.
Argelia Leon with Breathe California, and we strongly support this bill.
Nicole Wertelman on behalf of the Alameda County Board of Supervisors in support.
Marcy Berman on behalf of several labor organizations, California Conference of Amalgamated Transit Union, California Conference of Machinists, California Teamsters Public Affairs Council, Engineers and Scientists of California, International Longshore and Warehouse Union, Unite Here, United Food and Commercial Workers, Utility Workers, Local 132, Professional and Technical Engineers, Local 21, and California Official Court Reporters Association.
Could you repeat that, please? Libby used to be able to do that. That's all we've got for support.
What is the opposition?
Good afternoon, Mr. Chairman and members of the committee. My name is Rob Cherup. I am the president and founder of Casa Bellicoso Cigar Lounge, located in Walnut Creek, California. Casa Bellicoso was incorporated in 2008 and is in full compliance with California Labor Code 6404.5. We are a purpose-built destination for the sales and consumption of premium handmade tobacco products. We currently employ 4 employees, including myself. The jobs were created during one of the worst economic downturns since the Great Depression. Currently, if SB 575 as written were to become law, Casa Bellicosa's ability to serve its customer would be severely impacted, and more likely than not, we would cease to exist. This would obviously curtail the additional excise tax revenues, sales tax revenues, property tax revenues, and obviously contribute to the current job loss in the state of California. Casa Bellicosa is one of the numbers vary roughly around 360 to 700 different businesses that derive primarily their revenues from the sale of tobacco products. The majority of these businesses are relatively small businesses with less than 10 employees. Okay, and we are as I stated, a destination place where people can come, have chosen to come and enjoy these the tobacco products. And I recognize that cigars, premium cigars, are not something that a majority of people enjoy, but there is a select few that do enjoy these products and would like to have a place to go to consume them. The other point I'd like to make today, and again, we are in opposition of SB 575. I don't think I said that originally. The other thing I'd like to make a point to, because it's been stated here that California was once the leader in anti-tobacco legislation with the passage of 6404.5. I'd like to point out that I think California is still the leader in this area, because it's been 6404.5 has been the model that has been followed throughout the rest of the United States. It's been the model that's followed throughout the rest of the world. It has withstood judicial challenges. It has withstood legislative amendments. And one of the greatest part of why I believe that 6404.5 showed a tremendous amount of leadership when it was passed is that it not only addressed the needs of the majority that chose not to be exposed to secondhand smoke, it also made specific exemptions for a very select group, a minority. And because of that, because the legislation had that carve out that exemption for retail tobacco shops and private smoking lounges, I believe that is why 6404.5 has stood for 15 years and has been the model for what has been a very strong, large movement in anti-tobacco. I would like to point out, I understand there's a concept of ambiguity. Again, I built my business in 2008 with the 6404.5 as my model. I worked tremendously with the city of Walnut Creek and the Contra Costa County. One of the things I found very interesting was that it required me to actually re-educate both the county health department and the city as to what was and what wasn't allowed according to 6404.5. It has worked so well that the people charged with enforcing it in some aspects weren't familiar with what was allowed under the state law and what wasn't. So we work together. We do operate. I do have my beer and wine license. I do serve alcohol on premise. I have a loosely based, because there's nothing formal, but I do have a loosely based agreement with the city of Walnut Creek that we will operate in a similar situation to a restaurant, where we will not allow the alcohol sales to exceed 40% of our revenue. Our current revenue makeup has alcohol sales actually not exceeding 20%. And that's just a nature of the business. The primary reason people come to my establishment is to purchase and consume premium handmade tobacco products.
Thank you. Other witnesses?
Esteemed Chair, esteemed Senators, thank you for the opportunity to come before you. My name is Richard Duncan, and I own and operate a cigar lounge in Los Gatos, California. It is a private membership lounge. The only thing we do sell there is premium tobacco cigars. I'm a retired paramedic, flight medic, and firefighter from Alaska. I took my retirement, came to the great state of California to open up my second passion, which is cigars, and to continue just a wonderful life and being able to provide for my family. Our members come from all walks of life. They come there strictly for the sole reason to enjoy the time that they can with a cigar. We are a standalone building, And since I've opened it up, we've put in an incredible ventilation system. And we understand the importance of our customers' comfort while they're there. And we want to provide them a nice place to come and enjoy that premium cigar. So that's why we have invested the time and work to do that. These customers, members that we have, they come in to enjoy that cigar because they don't want to do it at home. They don't want to do it in their car. They come there specifically so they can enjoy something without offending other people. And we appreciate that. And so we give them a place to do that. So that's really important for us. So I just would like to ask you to look at carving out an exemption for $5.75 for cigar lounges and such that we operate. And we think that this will be a great thing for the state of California so we can continue paying taxes and help support the state. Thank you for your time.
Other witnesses?
Mr. Chairman, members of the committee, my name is Ron Michelson. I'm a tobacconist. I own 2 stores in Sacramento, one in Arden Fair Mall and the other in Loman's Plaza. The Arden Fair Mall store has been there for over 35 years and is the second oldest tobacco store in Sacramento. Our Loman's Plaza store, which is about 4 times the size of the original at 700 square feet, we opened about 2 years ago, and we did include and incorporate a membership lounge in that store. Both of our stores do allow smoking. Our clientele is adults, and as a matter of fact, by law, we cannot allow anybody under the age of 18 in the stores. That was something that we did before it became law, and of course would continue to do that. Our lounge in Loman's Plaza is approximately half of the size of the store, the total store. It's about 1,000 square feet. We have invested in these 2 stores about $750,000. And I can tell you for a fact that if this bill passes without changes, there will be one more small business that will no longer be in business. Just one other point I'd like to make. To a person, my 5 full-time employees and 6 part-time employees believe it is one of our greatest benefits that they're allowed to smoke on the job. Thank you.
Other witnesses?
Yep. My name is Vijay Rao. I'm the head of a group called the Guanxi Lounge Alumni. We're a cigar appreciation society in San Francisco. I am not a tobacconist, unlike the gentleman you just heard from. I'm a customer. My group has about 60 members, and every week we get together about once a week. We go to various establishments in the Bay Area, less so in San Francisco now since they passed their anti-smoking law. But we visited Rich's Lounge and Rob's
Senator
Lounge
Leto.
and Senator Leno. We still have the Occidental, though. And basically the reason that people want to join my group, the reason that we get together once a week, is so we're not smoking at home, we're not smoking in front of the wives, we're not smoking in front of the kids, we're not smoking in front of the grandparents. You know, we're getting together, like-minded individuals, in a place that only people who wish to engage in cigar smoking or tobacco smoking will be. You know, we're gathering in a place that people who choose not to be around secondhand smoke would prefer not to go to. And we think with the proposed legislation, SB 575, it would take away our ability to meet and gather with like-minded individuals and participate in what is a legal activity. Thank you very much for your time.
Thank you. Other witnesses?
Mr. Chairman and members, James Jack here on behalf of the Cigar Association of America. We represent the National Trade Association of Manufacturers, Importers, Distributors, and Major Suppliers to the industry. Also testifying today on behalf of the California Association of Retail Tobacconists. The Senator has been incredibly collaborative on this process. He has opened his door to listen to the industry and the concerns that we have. We commit to continuing that dialogue. However, until the bill is amended, we must remain opposed. Thank you.
Other witnesses?
So I'm Brenda Roberts. I'm proprietor of Baker Street Tobacconist in Napa. And to me, not being able to, I've had the store for 25 years, and not being able to smoke in my smoke shop would be like a winery not being able to drink wine. It doesn't make any sense. People that come to my store realize that that's what we do. If they don't like it, they're welcome to leave. And it works that way. Free enterprise works. I would definitely question the so-called science that the American Cancer Society, et cetera, brings up, as they've categorized secondhand smoke as the same as diesel. Think for 1 minute, if we filled this room with smoke from your car, we'd all be dead. If we filled this room with secondhand smoke, we might cough and our eyes might water, but that would be it. So it's a little bit out of whack. So I would strongly oppose that we do not support SB 575.
Thank you. Other witnesses?
Paula Treat on behalf of IPCPR. It's the International Premium Cigar and Pipe Retailers Association. Opposed unless amended. We've asked for the carve-out for the tobacco shops. If I was Amiano, I'd say smoke them if you got them, but that's a different product. So in this case, I mean, cigars, they're marketed differently, they're made differently, they're smoked differently. It's an adult hobby, and we would ask that they be carved out. As you'll find that for most of the tobacco shops, coming in and sampling the product is part of the whole deal. Otherwise, they might as go straight to the internet and buy, because it's a lot cheaper to buy there than it is, and pay the excise tax and the sales tax in the state. So we ask for a carve-out, please.
Thank you. Any other witnesses? Questions from Kabidi? Senator Yee.
Thank you very much, Mr. Chair. And Senator Saulnier, I think we've had this conversation. So, what progress have you made in terms of that carve out and so on?
Well, first of all, I want to thank most of the witnesses, almost all, for their tone and their very honest expression of their predicament. So far the conversations have been, I think, very productive. I appreciate Jack's comment about it's true that we've had a very open door policy. So we are almost regularly talking to both the sponsors and the opponents to try to figure out a way to do this. And in addition to that, talking to members who have expressed their own concerns, including the chair of the committee. So we'll just keep working on them. My promise, my commitment to the chair and to you is that we will continue to do that, understanding full well that the chair can pull if it's the chair's desire and you folks to let it out today, we can pull it back. I'm hoping we accommodate them in some form or fashion. At this point, Senator Yee, the specifics, we've looked at standalones, we've looked at some kind of implementation period. Heating and air conditioning is become more of a problem as I come to understand it, because the Surgeon General has said there's no safe level even if you have your own, but I'm not giving up on that either. So there's a variety of different options. I will say that the other states that have gone further than us, some of them have been able to do carve-outs, 20 of the 25 in fact. So we're going to look at all of their carve-outs, and we're really going to work to some kind of mutually agreed to compromise. Knowing that, and I want to say this and be honest with everybody, we still have the determination that we want to protect the public health to the greatest degree possible. So I don't want to lead people on. This is a tough negotiation, but we're open to trying to get to a point, and I believe we can.
So if I can make my comment, clearly there are a number of shops in San Francisco where it is an intention of all those individuals who enter into that particular business that their sole purpose is, in fact, to smoke. Until we make that, product totally illegal, I mean, the fact is that they go in there of their own choosing, and no other individuals are going to be there who do not intend to either smoke or to, be in that particular environment. And so, given that, I want to be supportive of that particular activity, and so my concern is whether or not at the end of the day we're going to end up supporting some kind of a carve-out that will allow them to continue to exist. My vote to move this bill out may then, in fact, contribute to the demise of those particular businesses if, in fact, the carve-out is not, done. So that's the dilemma that I have, and I appreciate your honesty and forthrightness that it is a difficult challenge and so on. You can't guarantee me that there is going to be a carve-out, and so I'm in a dilemma whether or not I'm going to vote yes or no on this particular bill, because I think 2/3 of it I support, but then you've got that 1/3 that creates a lot of angst in my city and in a lot of businesses in the city. So that's the dilemma that I have, and maybe as we hear more about the discussion, then I can be persuaded one way or the other.
I will say you have my commitment, Senator Yee, and I think in the period of time I've been here, I've been faithful when I've given these commitments that I will work in the manner that I've described, and if we can't pull something out that's agreeable, we'll be back in front of this committee. That's not my desire to come back here. I'm hopeful that we can have a compromise, that we can move on. So I hope your vote, I hope we get today, but it is a vote that I know is conditioned on the comments you've made of coming to some kind of remedy.
Other questions? San Leno.
Thank you, Mr. Chair. Out of respect for time, not reiterate some of the concerns already made. I have no challenge to the concern of secondhand smoke, and I applaud your efforts here. I'm with you 100%. It is a public policy conundrum that there are folks who want to congregate and really want to spare their families the secondhand smoke, and so they go to a place where everyone agrees we're going to risk the health concerns of secondhand smoke because this is what we want to do. The ventilation problem, I think, is the key factor here, so I don't know as much as you've already learned. In the process of this conversation, though, I'm just reminded that when Senator Yee and I were on the County Board of Supervisors together and we were dealing with the issue of medical cannabis dispensaries and the allowance for some dispensaries to be able to allow patients to smoke on premises, we had to do a carve-out for them because of our local anti-smoking ordinance. So I just wondered how that issue might also be impacted by the bill in front of us.
I'm less familiar with that than... Yes. Paul, do you want to try too? Or?
Alicia Sanchez from the American Cancer Society. This bill deals with tobacco products, and so it would not encompass those businesses. Yeah.
And with that in mind, just trying to keep myself intellectually honest, that though I know that there are different medical concerns about secondhand cannabis smoke and secondhand tobacco smoke, that I'm going to continue to work with you as you work with the oppositional voice so we can find some common ground here. Thank you. And I move the bill.
Thank you, Mr. Chair. Also, in the interest of time, don't want to be too redundant, but do want to add my voice in support of the bill, but also sort of with the understanding that there's ongoing work to do to create the appropriate carve-outs, which means it's limited, not too wide, not too narrow. At the risk of sounding presumptuous, I think I'm in the upper echelon, if you will, or in the handful of legislators that have tried to legislate in this arena, driven first and foremost by access to minors. I mean, we're not going to rehash the debate or whether secondhand smoke is harmful or not, whether tobacco is a known carcinogen and its consequences, et cetera, et cetera, et cetera. I'm fully on board. But even as strong as I've advocated, I recognize that California and municipalities, even more so than on a statewide basis, have gotten to the point where, okay, but for maybe some club-type mechanisms or establishments, and we're really talking more cigars and pipes and that sort of thing, not cigarettes. If we're going to start making it pretty much prohibitive to smoke in that environment, then smokers, because we haven't banned tobacco in California, where would they go smoke? In parks? Well, we don't want that. In homes where very, very few people live truly alone, we don't want that. It's not in the workforce. It's not in... so I'd rather have it isolated, if you will, with minimal impact to others. So, just to add that into your thinking as the conversations and negotiations continue. I'll also take a moment to highlight one of my bills that won't be coming by way of this committee, but I think can work in tandem with your bill, and that is a bill that seeks to grant the Board of Equalization the ability to deny a tobacco retailer permit when it's in proximity of a school, similar to what we do for alcohol. So you're looking at what's happening in the establishment. This is sort of not just within the establishment, where the establishment is located. We know that the closer a retailer is to a school, the more likely they are to violate the law as it pertains to selling to minors. So there's multiple pieces at work here that I think can and should work together. So happy to be supportive today and would happily engage with you on making sure that whatever carve-out is pursued, again, is not too narrow but not too wide.
Just briefly why I can't be supportive today, for some of the same reasons, and it's possible later on. But it just strikes me that virtually every, and as Senator Padilla said, my biggest concern is minors and access to minors. I wish it weren't in films. That was a problem for a while. It seems to be a little bit less now. But for people who know these risks, and there's virtually no adult who doesn't, there has to be some place where they can do this. I was in a workplace when I was much younger where I was where I was working, it was just accepted. Everyone smoked. It's not a good thing. But there needs to be, in my mind, places where people can go, and there's a number of people, maybe it's probably already been mentioned, but there's a number of us in this body who enjoy smoking cigars. And that's become something way before the smoking tent that, and I don't indulge. I don't like cigars, but there's a lot of people who do, and it just seems to me they ought to be able to have some places where they can do that.
And the author and I had a good conversation yesterday. I share some of the same concerns brought up by Senator Yee and others. Senator Yee, if the author's made a commitment that he's going to work with the opposition on what an appropriate carve-out would be, if they can't get to an agreement that this committee has the right to call this bill back for action, does that satisfy your concern?
Mr. Chair, if that's your understanding in speaking with the good senator, I will take his word and your work, and I'll go ahead and support that. I think the point is that, these businesses, in fact, are catering to only those individuals who intend to smoke, intend to participate in that particular activity. These activities are currently legal. And therefore, they are existing businesses. It seems to me that, we've got to find a way to protect those businesses. And as long as we do that, I'm fine. Okay.
Senator Sonia, you okay with that understanding?
Yes.
Okay. Anything else from the committee? Do we have a motion? All right. Roll call.
Do pass to appropriations is the motion. Senator Liu?
Aye.
Liu, aye. Wyland? No. Wyland, no. DeSaulnier?
Aye.
DeSaulnier, aye. Leno?
Aye.
Leno, aye. Padilla?
Aye.
Padilla, aye. Runner? Yee?
Aye.
Yee, aye.
We're going to put that bill on call. It's enough to get out.
We will stay in touch, obviously, to the degree that any of you want to be engaged in the discussions. You're more than welcome, and we got the message loud and clear.
Thank you. Then I got my bill, and that's it, right?
And then we just need to close the cars, too.
Okay.
No opposition.
No opposition.
No witness.
Oh, were you? There you go, Senator.
Be quick, because this is going to go fast.
That's fine. And then after he's done, we're just going to do the call. Hopefully we'll be quick.
I believe you.
Okay.
I did miss that.
All right.
Chair's bill.
Thank you. Senators, this bill has no opposition. It would require the governor to establish, through the California Workforce Investment Board, standards for certification of high-performance local workforce investment boards that meet specified criteria. The bill would also require the governor to establish the High-Performance Workforce Investment Board Fund and require the California Workforce Investment Board, in consultation with the governor, to allocate and award specified federal discretionary funds to high-performance local workforce investment boards. Basically, we're establishing standards to about 15% of the funds that we receive in California through the federal government, where there really are not very many standards. That's basically the intent of this bill, and I vote this here in support.
Thank you, Mr. Chair, members of the committee. Mitch Seaman with the California Labor Federation, and we're also here in support of this bill. It's one of 3 workforce investment force bills that we're working on that work as a package to overall just make the whole system work a lot better. This one is pretty simple. As the author mentioned, all it does is ensure that there is a level of standards there that the local WIBs are there to meet. The reason for the bill is that most involved in this agree that the current federal standards are inadequate. Excuse me. They are extremely easy to meet. They're negotiated with the local WIBs and only focus on a very small number of the workers that actually go all the way through the system. So the important thing to know is that no one ever fails. They basically meet these standards every time. And what the bill would do is it does 2 things. One, it starts a process where the local WIBs have a conversation with the state WIB, and then they come up with the plan that they're all going to meet. And the plan will involve them making sure that the local plan aligns with what's happening in the community colleges and state-approved apprenticeship programs so that as many workers as possible do eventually connect with stable long-term employment. And another thing that it does is it in no way affects the federal formula funds that they currently acquire, which is 85% of the funds that come through. All this does is allow these high-performing boards to secure some of that 15% of discretionary funds that come through. So it's just an added incentive and in no way punishes or penalizes existing WIBs. And we think it's a good bill, and we urge your support.
Mr. Chair, I move the bill.
Thank you, Mr. Vice Chair. Mr. Chair, thank you. Jeremy Smith on behalf of the State Building and Construction Trades Council. I'll be very brief given the motion. Just wanted to add that we aren't the only state doing this. Kentucky, North Carolina, Pennsylvania, South Carolina, Michigan, and Missouri have already done something similar, set standards for their local WIBs to follow. We want to make sure we have this conversation. Conversation's going to happen at the state WIB board. Local WIBs will be part of it. Stakeholders will be part of it, so it's going to be a very large group of people figuring out how to make these WIBs work better, and we support the bill. Thanks.
Cynthia Leon with the California Manufacturers and Technology Association. And the business side of this is very important to us. We are very supportive of Senator Liu's bill, and we are co-sponsors of all 3 of the bills that look at the Workforce Investment Act. I think it's long overdue. We have a lot of money coming in from the federal side, and we're not actually utilizing it to the best of our abilities. This is the first step in making sure that we meet a higher standard, and I'm very proud of a section in the bill which actually requires that that they do business services. It is not a current requirement. Many of our businesses struggle with working at the local level with the workforce investment boards because they don't actually see them as a potential partner. And I think it's time to change that, because I think in order to ensure that we have the right training programs, you have to communicate with the business community that actually creates the jobs. So we are very happy to support this bill and look forward to continuing the dialogue about Workforce Investment Board.
Okay, thank you. Comments from members? Questions?
Love it.
Let's get more career technical education.
We'll love it, I vote.
Opposition. More CTE in high school. Fix the dropout rate. All right. Let's call it over there.
Liu?
Aye.
Liu, aye. Weiland?
Aye.
Weiland, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Leno?
Aye.
Leno, aye. Padilla?
Aye.
Padilla, aye. Runner?
Aye.
Runner, aye. Yee? Has 7 ayes. That moves to approves.
The bill's out. We're going to lift the call on remaining bills. SB 407, please, by Canella.
Moved.
Okay. The bill's been moved. Roll call. I'm sorry, SB 407 by Senator Canella.
It's due pass to public safety is the motion. Lou?
No.
Lou, no. Wyland?
Aye.
Wyland, aye. Desaulnier?
Aye.
Desaulnier, aye. Leno?
No.
Leno, no. Padilla?
No.
Padilla, no. Runner?
I'm sorry, I misspoke. No. Staff was distracting, which is easy to do. Oh, come on.
Desaulnier, no. Runner?
Aye.
Runner, aye. Yee?
No.
Yee, no.
We put on reconsideration.
Yeah.
Bill fails. We'll put on reconsideration. Next bill is SB 459 by Senator Corbett.
The motion is due pass to judiciary. Lou?
Aye.
Lou, aye. Wyland?
No.
Wyland, no. Desaulnier?
Aye.
Desaulnier, aye. Leno?
Aye.
Leno, aye. Padilla?
Aye.
Padilla, aye. Runner?
No.
Runner, no. Yee?
Aye.
What else do we have
5
on
to
call?
2. 575.
SB 575 by Senator Desaulnier. Call the absent members.
Runner?
No.
Runner, no. That measures 5 to 2.
That measures out. Anything else?
And Senator Leno's bill.
And SB 826 for Senator Leno. Call the absent members.
Padilla?
Aye.
Padilla, aye. Runner? That measure has 6 votes.
That measures out. Is it? Did Senator Yee vote on the Corbett's bill?
I believe you did. Yes.
Yes, you voted aye. Okay. Anything else? All right. Committee is adjourned. Thank you.